Hi, everyone. Welcome back to Alcove Health Women's Clinic. Today, we are here in our clinic with one of our senior client advocates, Jenn. And it's always on a camera, clinic, and a question. We talk about questions we hear from our clients. And today, we're going to talk about the reality that many of the questions we hear are based on fear from a woman who is thinking, I have a pregnancy I didn't plan for, and so abortion is the option I'm going to consider. What do you say to that, Jenn?
So yes, women call in, and a lot of times what we hear is fear and anxiety. They don't know what to do. They don't know how to move forward.
It's one of the natures of it being unplanned, right?
Absolutely,
and so even when they come in, they're still fearful, but we encourage women to come in, and we want to show you how we here at Alcove Health can help you if you're afraid, facing an unplanned pregnancy and trying to decide your next step.
So this is one of our consult rooms that we'll bring a client into, and we talk about what's going on in their lives. What is this fear? Where is it coming from? What is it telling you? How are you feeling about it in your body? And what's going through your mind? And we talk through that. We work through that in this safe, non-judgmental space, this outside presence that can just sit and exist.
After this, there are other services. These are our advocacy services, but we also offer other services that really help a woman who is afraid to have an abortion because they help reveal things that she can't know without them, right?
Absolutely.
Let's talk about those.
Okay. So, Sherri, after the consult, we bring our clients back to one of our ultrasound rooms where they meet with a registered nurse. They're going to receive a laboratory-grade pregnancy test. And they're also going to be assessed for an ultrasound, which is incredibly important. We need to discover three things: that the pregnancy is viable, that it is in the right place, otherwise that's a medical emergency, and exactly how far along our clients are, because their last menstrual cycle isn't always the best indicator.
Right. And so some of their fear is probably based on the fact that they don't know the answers to these questions. And in that respect, that fear is healthy because it would not be wise to go on and have an abortion if you didn't know the answers to those questions first.
You know, here we talk about the emotional, the mental, and the physical side effects or implications of abortion. And the first thing that we want to establish is that women are not paying for a service that they don't need,
right? That
they're not having to make a decision they don't necessarily want to make.
Right. And you've even said, I've heard you say it before, sometimes it is a relief to a woman who thought, I've got to make this big decision. And she finds out, I'm in the process of miscarriage. I don't have to make that decision. Or my pregnancy test wasn't accurate. I don't have to make that decision. So really helpful information to a woman who's frightened, thinking, what am I going to do if I want to have an abortion, right?
Absolutely. That information is a relief to women who are considering abortion.
Right.
They don't have to make that decision.
Right.
And we care about our clients' mental health, their physical health. And so it is a joy for us to be able to give them that information.
Right. And then spare them the after of having to make a decision they never even really needed to make, right?
Right. A decision they didn't have to make financially and emotionally.
That's right.
So one of the things I hear every single time is that after my clients come in and they walk out these doors, they feel so much better. They do have that relief, less fear, less anxiety, the opportunity to work through everything that is going on in her life that leads up to this decision.
It is amazing that we can say one appointment. You walk in fearful. You walk out feeling better from one appointment. And the reason that is because you matter here and your fears matter here. So listen, if you're in the local area and you want our medical services and compassionate care from our nurses, from our advocates, find our website on the end screen, make an appointment for yourself. Come in and see us because fear shouldn't be the biggest driver in a decision that's this big. And we're here to help you work through that fear.